Most people will ignore these signs, brushing them off as just another part of getting older or being stressed. But these aren't just random aches and pains. I'm Dr. James, and today we're talking about 10 common pancreatic cancer symptoms you might be ignoring right now. Recognizing them isn't about creating fear. It's about empowering you with knowledge. These early warnings are your body's way of telling you something is wrong, and listening could be the most important thing you ever do. Let's break down what you need to look for, because awareness is your first and most powerful line of defense. Many of the earliest symptoms of pancreatic cancer are incredibly subtle. They are mild and very easy to mistake for everyday discomfort. You might think it's just stress from work, something you ate, or a sign that you need more sleep. This is why pancreatic cancer is often called a silent disease, but it's not truly silent. It whispers. These whispers are small changes in your body that feel so normal, so easy to dismiss, that you don't even think to mention them to your doctor. We're talking about feelings that come and go, sensations that don't seem serious enough to warrant concern. But the problem is that these seemingly insignificant issues can be the first clues that something more serious is developing internally. It's this deceptive mildness that allows the disease to progress unnoticed. The key is to stop dismissing these persistent, nagging feelings and start paying attention to the pattern they create. One of the most common early warning signs is abdominal or back pain that comes and goes. This isn't the sharp, debilitating pain you might expect. Instead, it's often a dull, gnawing ache that settles deep in your upper abdomen. You might feel it right below your breastbone. Sometimes, this pain radiates straight through to your back, settling between your shoulder blades. You might notice it more after you eat or when you lie down at night. Because it isn't constant, you'll probably blame it on something else. Maybe you think you pulled a muscle at the gym, slept in a weird position, or are just dealing with indigestion. You might take an antacid and feel a little better, or shift your position and the pain subsides for a while. This intermittent nature is what makes it so easy to ignore. But if you have a persistent, nagging ache in your upper abdomen or back that just doesn't seem to have a clear cause and keeps returning, it's a signal your body is sending that you shouldn't overlook. Another significant red flag is unexplained weight loss. We're not talking about losing a few pounds after starting a new diet or exercise routine. This is weight that seems to melt away without any effort on your part. Your clothes might start to feel looser, or the number on the scale drops week after week, and you can't figure out why. This happens because a tumor on the pancreas can interfere with its ability to produce the enzymes necessary for digestion. Your body starts to struggle to break down foods, especially fats, and can't absorb the nutrients it needs to maintain its weight. You might be eating the same amount as always, or even more, yet you continue to lose weight. For many people, this seems like a good thing at first, a welcome surprise. But unintentional weight loss of 5% or more of your body weight over a few months is a serious medical sign. It's your body telling you that its fundamental metabolic processes are being disrupted. Alongside weight loss, you might notice significant changes in your appetite or feel full very quickly. This symptom is often subtle and develops gradually. You might sit down for a meal you normally enjoy and find you can only eat a few bites before feeling uncomfortably full. The desire to eat just isn't there anymore. This early satiety, the feeling of being full sooner than normal, can happen because the tumor is pressing on your stomach or because the digestive process is slowing down. Food sits in your stomach for longer, making you feel bloated and disinterested in eating more. This can also contribute to the unexplained weight loss we just talked about. You may dismiss it as just not being very hungry lately, or assume your appetite has changed due to stress. But a persistent lack of appetite, or feeling full after small amounts of food, especially when it's a new pattern for you, is a classic sign that your digestive system is under duress and needs to be investigated. Persistent fatigue is another common yet frequently ignored symptom. This isn't the kind of tiredness that a good night's sleep or a cup of coffee can fix. This is a profound, bone-deep exhaustion that lingers day after day, no matter how much you rest. You might find yourself struggling to get through your workday, needing to nap constantly, or lacking the energy for activities you once enjoyed. This overwhelming fatigue is a result of the body's response to the cancer. The tumor triggers widespread inflammation, and your body expends a tremendous amount of energy trying to fight it. Furthermore, because your body isn't properly digesting food and absorbing nutrients, it's being starved of the fuel it needs to function. This combination of internal inflammation and metabolic changes creates a state of chronic exhaustion. It's so easy to blame this feeling on a busy schedule, age, or stress. But if you are feeling persistently drained and depleted without a clear reason, your body is signaling a deeper problem. You may also start to experience a range of digestive problems that seem to appear without a clear cause. This can include persistent bloating, uncomfortable gas, or a general feeling of indigestion that doesn't go away. You might notice your stomach feels swollen or tight after meals, even if you haven't eaten much. Nausea can also become a frequent companion, sometimes accompanied by vomiting. These issues arise because the pancreatic tumor can block or slow the flow of digestive enzymes and bile, leading to a backup in the digestive tract. Food isn't broken down properly, causing it to ferment and produce excess gas and discomfort. Because these symptoms are so common and can be caused by countless other things, from food intolerances to irritable bowel syndrome, they are very easy to dismiss. However, if these digestive troubles are new for you, persistent, and don't respond to typical remedies, they warrant a conversation with your doctor. A very specific and alarming sign is the appearance of light-colored stools or dark urine. These changes are directly related to the pancreas's role in the digestive system. The pancreas is located next to the bile duct, which carries bile from the liver to the intestines. Bile is what gives stool its normal brown color. If a pancreatic tumor grows large enough to block this duct, bile can't get through. As a result, your stools may become pale, clay-colored, or greasy. At the same time, the bilirubin from the blocked bile builds up in your bloodstream and is then filtered out by your kidneys. This excess bilirubin turns your urine a dark brown or tea-like color. You might notice this change first, thinking you're just dehydrated. But if your urine stays dark, even when you're drinking plenty of water, and especially if it's paired with pale stools, this is a strong indicator of a bile duct obstruction that needs immediate medical attention. As bilirubin levels continue to rise in the blood, you might develop mild jaundice. This isn't always the dramatic all-over yellowing of the skin that people often picture. It can begin with very small, subtle color changes. The first place you'll likely notice it is in the whites of your eyes. They may take on a faint yellowish tinge. Your skin might also start to look slightly yellow or sallow, a change that can be harder to spot, especially in certain lighting or on darker skin tones. Your friends or family might even notice it before you do. Jaundice occurs because the blocked bile duct prevents bilirubin, a yellow substance made when red blood cells break down, from being properly excreted. It backs up into the bloodstream and gets deposited in the skin and eyes. Even the slightest hint of yellow in your eyes is not normal and should be treated as a serious warning sign. Another surprising symptom linked to rising bilirubin levels is itchy skin. This isn't your typical dry skin itch. It can be an intense, all-over itching sensation, known as pruritus, without any visible rash. The itching can be severe enough to disrupt your sleep and impact your quality of life. It happens because the bile salts that build up in the bloodstream due to the bile duct obstruction get deposited in the skin, irritating the nerve endings. You might find yourself scratching constantly, unable to find relief with lotions or creams. Many people will assume they are having an allergic reaction or are suffering from a skin condition like eczema. They may see a dermatologist before ever considering an internal cause, but widespread, persistent itching without a clear skin-related cause, especially if it occurs with any of the other symptoms we've discussed, is a significant clue that something is wrong internally. Finally, one of the most important hidden warning signs is the new onset of diabetes, especially in someone over the age of 50 who doesn't have a family history or typical risk factors like weight gain. In fact, you might even be losing weight when you're diagnosed. The pancreas produces insulin, the hormone that regulates blood sugar. A pancreatic tumor can damage the insulin-producing cells or cause insulin resistance, leading to the development of type 2 diabetes. For some, a sudden and unexplained change in blood sugar levels is the very first sign of an underlying pancreatic cancer. It's why many in the community, including us at Pancreatic Cancer Warriors, advocate for anyone with a new diabetes diagnosis to consider the possibility of a pancreatic issue, particularly if the diagnosis doesn't fit their personal health profile. If your doctor tells you that you suddenly have diabetes and you're not overweight and have no other risk factors, it's crucial to ask if your pancreas could be the cause. Recognizing these 10 signs early can drastically improve outcomes. The symptoms we've covered: abdominal or back pain, weight loss, appetite changes, fatigue, digestive issues, pale stools, dark urine, jaundice, itchy skin, and new-onset diabetes are your body's early alert system. The members of our Pancreatic Cancer Warriors community often share stories of how they wish they had connected these subtle dots sooner. These signs are easy to ignore because they mimic everyday life, but their persistence is what sets them apart. They don't just go away. Listening to your body when it whispers is the first, most critical step. Don't dismiss what feels wrong just because it seems small. Trust your instincts. Paying attention and speaking to your doctor about persistent, unexplained changes can truly save your life.